Malnutrition contributes to nearly half of all child deaths in Nigeria. In 2014, up to 1 million children under 5 suffered from severe acute malnutrition. This is exacerbated in Niger State, the largest in Nigeria, as the population is widely dispersed and has limited access to healthcare. Since 2013, Malaria Consortium has been training community-oriented resource persons, or CORP, to diagnose and treat common illnesses in children under 5 years, including the main killers, pneumonia, diarrhoea, and malaria. The organization has also been training CORP to screen under 5s for malnutrition and refer severe cases to health facilities. More recently, the RISE project has been trialling tools for use by community health workers with low literacy to assess their ability to move beyond screening and referral of malnourished children to providing treatment in the community. The tools were tested with 60 CORP during their assessments of children. The CORP engages in the following process. Having established his outpatient clinic, he informs those waiting how things will proceed. He is then ready to begin assessing the children. He begins by using mid-upper arm circumference, or MUAC, tape to gauge the level of undernutrition. The tape has been modified from the normal tape, so it can be used without the need to read numbers. The number bands have been replaced with coloured bands of bright red, dark red, pink, yellow and green. If the MUAC shows the child falls within the bright red part of the band, they should be immediately referred to the health facility, as they are in serious danger due to the severity of their malnutrition. If the tape shows dark red or pink zones, the child is suffering from severe acute malnutrition, and the CORP then needs to see if they are well enough to be able to eat. He also checks the child for any other symptoms of severe illness requiring referral. The caregiver is given a packet of ready-to-use therapeutic food to see if the child will accept it. This is a special paste prepared for malnourished children that does not require cooking and can be eaten straight from the packet. Once the child shows he is able to feed, they are ready to be weighed. This involves using a modified scale, which shows the number of food packets that the child should be given each day, rather than their actual weight. Based on the measurement, the CORP prepares the 7-day meal guide for the caregiver. Before giving the caregiver the food pack, the CORP uses visual aids to ensure she understands what she needs to do at home and how to use the packs. Throughout the process, the CORP records everything in the specially modified patient register, which does not require them to be able to read or write. Here the child is identified using colour-coded matching strips. The CORP receives regular supervision and support visits from the local government authority and State Ministry of Health. Malaria Consortium's research from the RISE project has shown that low-literate community health workers in Niger State can effectively use these tools to identify and treat malnourished children. It also showed that with much easier access to care for their children through the CORPs, caregivers are not only using the services, but are also more likely to stay in the program for as long as necessary. As a result of the success of the trial, Niger State is to open 6 new therapeutic feeding centres to help address malnutrition in the region.